Jonathan, nice to have you here.
Thank you.
Welcome in Germany. You are the CEO of World Physiotherapy. What is World Physiotherapy? What do they do? And what exactly is your part of it?
Sure. Thank you very much for the opportunity to talk to you today and to talk directly to some of your readers and listeners in Germany. So World Physiotherapy is the global organization representing the physiotherapy, physical therapy community. So we have 127 member organizations and represent more than 600,000 physiotherapists across the globe. So within our membership, we have essentially one member organisation per country or territory from around the world. So in 1951, we started with 11 member organisations, and then we've moved up to 127 at our most recent general meeting. So in 1951, our founding members included West Germany at the time, as well as Australia, where I'm from, the UK, the US, Canada, New Zealand, Norway, Finland, Sweden. So countries that are very similar, perhaps, in the way that physiotherapy was practiced at that time. Now we have a huge diversity of members, and some of our most recent members were Angola, Vietnam, Oman, etc. So, you know, physiotherapy associations from different parts of the world. And really our goal is to try and represent physiotherapy at a global level. So we're in official relationship with the World Health Organization and the United Nations, as well as many global NGOs such as ICRC, the Red Cross, as well as Humanity and Inclusion, etc. So we work very closely with those global entities to try and raise the standard of physiotherapy across the globe.
Fantastic. So we have been a founding member.
Yes, Germany's been a member for, what is it now, 72, 73 years or something like that. So it's been a while. And at different times, Germany has been very active and at other times maybe perhaps less active, but has been a member that entire time.
Okay. So why we're here, actually, you and Ater, who is responsible for the Europe region of World Physiotherapy, you have sent open letters to the German Ministry of Health regarding the state of academization in German physiotherapy. What was your intention?
So the World Physiotherapy policy around entry-level education for physiotherapists is that we believe that physiotherapy education should occur at a university setting, and it should take at least 4 years of university training. So this has been our policy for many years. And at the invitation of ZVK, we were invited to write this letter and really just present the situation as we saw it in Europe. And what we see in Europe is that Germany is an outlier. So Germany is very different in terms of the way in which physiotherapy training occurs compared to other parts of Europe and other parts of the world. And so what we see in Germany is that there is 2 tiers of education going on. So there's a university level education going on, but there's also this sort of technician or qualification going on at a less than university level. And so it was really just to point out that this is very different to how the physiotherapy education occurs in other parts of Europe and other parts of the world.
Compared to other nations, how is Germany scoring? If we compare to football, so what are we on eye level with?
So, I mean, there are other parts of the world. So there is no other country in Europe that still has a diploma, so or a certificate level. So everybody else is at least a bachelor level. In places like Poland, they've pushed it up to a master's level, and that's the intention in places like France as well. In Australia, where I'm from, we have both bachelor, master's and doctorate entry level. So this is the first degree that you get in terms of physiotherapy. But if you look at those countries that are still running a diploma, then it's countries in Asia or Africa predominantly where we see those perhaps lower level of training occur.
That's not exactly Champions League we are playing.
It's not Champions League, and what I would always say is that it's important that the training is what's needed by a country. So in some developing countries, some low resource countries, what they need is a physiotherapy workforce. So it's important for them that they train people quickly. You can train people quickly in a 2-year diploma. So in some of those countries that I mentioned in Africa and Asia, they just need people to be working there because they need the workforce to develop up. But they definitely have an intention to shift up to a degree level training. That's not the situation that I perceive in Germany. And if it, where, it's like, well, for me, it's trying to understand what's the rationale for having this lower level technician training in qualification in Germany, because you have lots of physiotherapists there. So why keep on training at a low level?
Okay, that's interesting because actually, yes, we have a shortage of workforce, so everybody's recognizing that at the moment. But the question is a low-level education the answer to it?
And what I would say is in a country like Germany, so a high-resource, wealthy country, it's hard to make that argument. I think that a lower trained qualification or a lesser qualification is the solution, when in fact working smarter at a higher degree might actually lead to different efficiencies within a healthcare system.
There's a lot of statements I hear very often when physios discuss academization in Germany. I would give you 3, and could you comment on them?
Yeah.
So one I hear very often is, we don't need just chiefs, above all we need the Indians.
So should I take them each? So with that one, what I would say is that in countries where there's degree training, there is still a hierarchy. So you don't lose that hierarchy. It's just a better trained hierarchy where people have shifted up. So for example, you're still a new graduate physio when you have your university degree. There is still senior people that have done postgraduate masters or postgraduate PhDs that sit above you within a healthcare hierarchy. So, still plenty of Indians, not everybody is a chief.
But it doesn't matter if an Indian can work with a scientific background.
Well, I would say that you're going to get better value out of somebody within a healthcare system if that person is trained at a level where they can review evidence-based practice, they can work at it in a contemporary model, rather than perhaps what they were trained to do 10 years ago, 20 years ago, etc.
Yes. Then another statement is, we are craftsmen. That's why we work with our hands. Academic physios are only theoreticians.
Okay, so even when you're working with your hands, something has to tell your hands what to do. So my thought would be that, wouldn't it be greater if you had a command center for your hands that was better trained, that was more highly trained, that could actually think a bit more about what those hands are doing? I'm not taking anything away from people that are highly skilled at what their hands do. Don't get me wrong, but I think that the idea that if you have a university training that you're still not going to be skilled in your hands is not true. If that was true, then why do we have surgeons training for 20 years to they're still craftsmen with their hands, but they've got the brain to go with it as well.
I see. Then the third statement, is direct access is dangerous because we get into liability. Academic physios, we prefer to remain dependent on the doctor's prescription.
So again, I hear this quite a bit. This isn't just a German thing. So when countries are working through to the shift to direct access, where they do have more autonomy, this is a fear, and I understand that. So I guess stepping through some of that fear. If the fear is around the education level, that's what we're talking about today. You increase the education level and your confidence to work in an autonomous, independent way will improve as well. Secondly, there is, and again, this will probably be a pushback, but there is, you can have insurance to cover you in case there is something that goes wrong. Okay, so cool. Your costs might go up if you start working independently, but I would say that your the quality of services that you provide would go up as well. So I think that's something there. But you know, I've yet to meet a physiotherapist that hasn't received who does not yet have direct access, who hasn't received a referral from a doctor which is wrong. They know it's wrong and that they don't want to do what the doctor has prescribed, but they feel they have to or whatever, even though they know it's not going to work because that's not the issue. So I think that even without that university education, you do get better at understanding, what is the evidence behind what you're doing. So I think that there's good research to support physiotherapy direct access. And, if you're ever going through the process in Germany to try and get direct access, in the same way that we've recently helped the order in France to get direct access there is a ton of evidence to show that this is it's safe and effective. Patients like it, and it gives better quality of careers for physiotherapists.
All right. So maybe it's just a very comfortable corner. If you don't have any liability, just do what you get prescribed. Maybe that's
And even if you got the rights to direct access in Germany, it doesn't mean you have to do it either. That's the other thing. So you might decide that actually I just want to continue working under the direction of a doctor, and that's just how I'm going to operate. Okay, if you get job satisfaction that way, then great.
Yeah, I see. So regarding the future development of our profession, why is a basic scientific education important to work as a physiotherapist?
So is your question why is a degree going to be better than just a diploma level?
Yes.
Yeah. So I think for me, what it does, it gives you the skills to stay contemporary. So one of the things about education at a university level is that you learn about evidence-based practice, you learn how to read research, you learn potentially how to do research. And by being able to read research and to incorporate that into your practice, that allows you to continue to grow and develop. So World Physiotherapy, we believe in lifelong learning. So you start with your entry-level qualification, but then every year you continue to do continuous professional development. So you go to courses, you read articles, you read new journals, etc. You incorporate them into your practice. So that's what a university training will give you, as opposed to a diploma, which teaches you how to do things now. But physiotherapy is evolving. The amount of research that's being developed within the physiotherapy profession is enormous. So if you don't have the capacity to incorporate that into your practice, then you won't be as contemporary as you could be.
So what are the benefits of an academization for physios, for patients, and maybe also for the health system?
So for physiotherapists, I think that it's a better quality of career. I think that you can continue to challenge yourself. You can continue to learn and to grow and to develop as a physiotherapist if you've got the right training. If you have a diploma training, it's very difficult to do any postgraduate education at a university level. You will have to go back usually to get a bachelor degree before you could go on to a master's or a PhD. Whereas if you start with a bachelor, you'll be able to go on to a master's or a PhD. So for me, it helps for your career to develop. For the patients, I think you'll be better treated by physiotherapists if they've had a university degree. I think that the training that happens there, I think you'll get all the clinical or practical training that can be quite similar to what you would get in terms of, clinical exposure during your training. But I think that, for the patients, they get better treatment by physiotherapists that are trained at a university level. For the healthcare system, I think that actually by having more university-trained physiotherapists, you're more likely to have physiotherapists engage with reform of the healthcare system and for challenging the healthcare system. So if there's research that's done, if there's new ways of doing things that have been validated through research, then that can help the healthcare system. Increasingly, physiotherapists are looking at the economic costs of our treatment. So, is this treatment both clinically worthwhile as well as economically worthwhile? And so I think that those things help to feed back into the healthcare system where potentially physiotherapists can look at reforms and ways in which we can look to make the healthcare system more efficient and potentially save money or put money into areas which have the greatest benefit to the public as well as to government finances.
Those who oppose academization here in Germany and those who complain about the shortage of skilled employees, they are the same people.
Mm-hmm.
Would you like to comment?
So I think I'm not going to tell Germany what Germany needs to do. However, you've asked me a question, so let me give you an example. I think that there could be some way in which you could reform the system so that you might have two tiers of part of the physiotherapy workforce. So, for example, you might say that, and you could have a grandfathering process so everybody is a physiotherapist now. But into the future, only those people that do a university training get to call themselves physiotherapists into the future. You still train people at a diploma level, but you call it something else. So it could be their physiotherapist assistants or physiotherapist technicians or something else. And what you do is then start looking at the healthcare system and going, okay, how do we have teams that actually might do things a bit more efficiently? So you have physiotherapy assistants, and this is how it works in other countries. Physiotherapy assistants doing the lower level technical things. You would have physiotherapists working at the level that they're at, senior physiotherapists, advanced scope physiotherapists, etc. So you sort of restructure the physiotherapy workforce based on experience and skill set as well as education. But you look at different ways of addressing the workforce shortage by a smarter way of aligning say, physiotherapy departments in hospitals. So instead of everybody being the same, you actually start a hierarchy which starts a career pathway, and that you use people to the full extent of their skills, experience, and education. And if that's technician, it's up to here. If it's university level, it's up to here. If it's master level, then it's up to there, etc. And so you get people who are more skilled, more educated working here, and less skilled, less educated working down the bottom. But, workforce shortages are a big thing, but having everybody the same, I don't think is a solution.
Yeah, so I think maybe we have a workforce shortage because it's not attractive to become a physio if there's a diploma.
Yeah.
So
Yeah,
maybe it's more attractive to become a physio when you have opportunities of an academic degree and you can proceed from there.
Yeah, and we've been using university, the word academic, and maybe it has different connotations in Germany than say here in the UK, but it is, you can still have a clinical degree even if you've got higher qualifications. So it's not like if you then go off to do your master's and the PhD that you're stuck at a university. What I'm saying is actually that potentially allows you to then get experience at a much higher level and to have a lot more sort of academic background behind you to then be far more highly skilled with the patient group that you're working with.
So that leads me to the question, did we make a mistake when we did not switch to an academic physiotherapy in the 1990s when others did?
I think that, was it a mistake? I don't know. I think there was a lot going on in Germany in the early 90s, so maybe you can, you know, you can be forgiven for that. But I do think that, as I said in the letter that I wrote, increasingly Germany is becoming an outlier. Germany was one of the founders of World Physiotherapy. So in the 50s and for many decades after that, it was a leading light of the physiotherapy profession. What I would say, for a country of 84 million people, the contribution from the into the physiotherapy research sector doesn't match the number of people in the population. So, you know, if you look at, again, a country like Australia with 26 million, like, it is a big contributor to physiotherapy research. And whether or not that's because we've had entry-level degrees for many decades, we've had direct access for many decades, you know, I think those things are true. That actually, you know, it's, if once you start to see having PhD candidates within physiotherapy departments, it builds upon itself. And I think that that is an exciting thing in terms of, you know, developing a research agenda for Germany. So how can German physios contribute to the healthcare system in Germany? You can only do it if you're skilled enough to do the research, etc. So was it a mistake? Look, you know, maybe it was a misread of where the world was heading. And I think that objectively, sorry, I've given some of my opinions today, but objectively, like I said, it's an outlier in Europe, and it's aligning itself up with other countries who definitely want to get rid of that diploma and are in far less equivalent circumstances. So I would say that, yeah, maybe it's time to correct.
Okay, Jonathan, a good fairy comes and you have 3 wishes for physiotherapy or for German physiotherapy, whatever.
Mm-hmm.
What would that be?
So what I would like to see in Germany, what I think would be great in Germany, 3 wishes, would be one strong national physiotherapy association, whatever form that takes. So we've seen countries around Germany start to develop orders and chambers, which have really been critical to elevating physiotherapy. So I think that there's a philosophical discussion around how do you unite the physiotherapy profession in Germany? And I think that one strong national association is the key to that. So I think I'd love to see an association where people just want to belong in Germany, and that there is a great percentage of the number of physiotherapists belonging to that association. Then like to see entry-level physiotherapy in Germany at a level of at least a bachelor degree. I think so that it now becomes the entry-level standard for physiotherapists in Germany. And then I think I won't push for it too hard, but I think a good discussion within the country around direct access and how, again, Germany can play catch up with many other countries around the world around direct access. So again, you know, this is a major global advocacy agenda for World Physiotherapy to try and get direct access in as many countries around the world as we can. And, you know, we'd love to work with ZBK, our member organization in Germany, to get direct access there. So I think that the three things actually are quite related, and one can help with the other and vice versa. So yeah, I think they're the three wishes which I'd like to I guess leave you with.